My name is Schwander, and today I'm going to talk about structural integration. There's many different forms of structural integration, including Rolfing, Heller work, core body work, anatomy trains, just to name a few. But all structural integration is based on some basic ideas about human structure. One is that most people are out of alignment with the forces of gravity. Two is that the body functions more efficiently when it is lined up with the Earth's gravitational field. And three is that the soft tissues of the body can be molded to bring the body back into gravitational alignment. So we achieve our results by manually manipulating the muscles and the soft connective tissue called fascia. Now this fascia surrounds and penetrates all the muscles and all the other structures of the body and gives the body its shape. So when the body loses its structure or balance or its architectural integrity, it's just like when a building gets out of balance and gravity will drag our bodies down. So these imbalances can come from poor posture, injury, illness, or emotional distress, and this shows up in our bodies as stress, pain, and decreased energy. So we're going to work to free these fascial holding patterns and restrictions in the body to bring the body back into alignment. Now I do a series of treatments. Each one prepares the body for the next session and also builds on the previous sessions. So the sequence that I follow is I start with the thoracic area and the chest. So trying to work around the diaphragm, between the ribs, along the sternum, the shoulder blade, the collarbone. So trying to free up the thoracic cavity as much as possible, because the more the thoracic cavity expands, the more the lungs will expand, the more oxygen will come into the body. So since all of the abdominal muscles also tie into the ribs and come down and tie into the pelvis, that prepares the body for the next session, which is for the hips. So with the hip session, we're trying to free up the hip joint, working the gluteal muscles and the other muscles that tie into the hip, where the femur ties into the pelvis, and get as much free movement in the hip as possible. And then we'll do a stroke the whole way down the iliotibial band to the lower leg, which prepares the body for the lower leg and the foot. And with that, we're trying to get as much balance in the lower leg and the foot, freeing up the ankle to get as much free flowing energy as possible. So after these first three sessions that open up the whole body, and basically works on the outer sleeve, then we're going to come back and get deeper into the more intrinsic muscles. We're going to come back and do the shoulder and get the whole shoulder girdle, which is actually the appendicular skeleton with the arms, the shoulder blade, and the collarbone, which sits on top of the core or axial skeleton. So again, by freeing up that whole shoulder girdle, that's going to allow the thoracic cavity to expand even more, and again, allow more oxygen to come into the body. After that, we're going to do the low back. So when you look on these charts and you see a big space between the 12th rib and the pelvis, the crest of the ilium, what's really happened, or most people are a lot more compacted and contracted in that area, so we're going to try to free up that area and expand the whole lower back in that area. After that, we're going to do the quadriceps and the adductors, which, again, on the front of the leg, the inside of the leg, to try to bring the pelvis more into balance. Then we're going to come back and do the abdominal cavity, again, getting into the diaphragm, working into the front of the pelvis. And from there, we're going to get the hamstrings in the back of the leg. And all these are going to work to get the pelvis more imbalanced, because if the pelvis is out of balance, that'll cause the rest of the body to go out of balance. After that, we'll do a specific session for the posterior pelvis, getting into all the muscles in the posterior pelvis, which again will help to balance the body. Then we'll do a session working the whole way along the spine to make sure the spine is in alignment with our balanced pelvis, and then we'll end with the neck, head, and face to make sure that the head is sitting on our balanced bodies. So when you take these courses in each individual session, it doesn't matter what order you take the courses in, because you'll learn techniques that you'll be able to integrate into what you're already doing. And when you come in for sessions, we'll address what your problem areas are, but ideally you want to go through all these sessions to get your body aligned and back into balance. So future videos will show a demonstration of some of the techniques we're going to use and thank you for watching our video.